From Minsure shows an overwhelming number of Minnesotans are switching their health insurance plans this year after open enrollment ended last month. And that's because of skyrocketing costs. Many are opting for plans with less coverage or none at all. Kent Erdahl joins us now with more. Kent?
For those who haven't used Minsure, it's our state's Affordable Care Act marketplace. And when Affordable Care Act tax credits expired at the end of last year, it became ground zero for health insurance rate hikes. Minsure rates jumped by nearly 22% on average, and we're just starting to see the impact.
All the way back in September, the CEO of Minsure helped raise concerns at the Capitol, announcing that if enhanced affordable tax credits were allowed to expire, 89,000 Minnesotans will pay more for coverage.
And over 19,000 will lose access to all financial help in 2026.
Several months and one big government shutdown later, those tax credits did expire. And according to Minsure, there are now clear signs of affordability issues, including an 87% increase in enrollees who switched plans.
They opted for a cheaper option than what they would have had they stayed in their plan from last year.
Does that mean then in turn that many more Minnesotans might be underinsured?
Yeah, it's certainly possible. So maybe your premiums are a little bit lower, but when you go to use that health insurance coverage, you might have larger out-of-pocket costs. And we know some folks really had to make that difficult decision.
Minsure CEO Libby Collins says others apparently decided they couldn't afford any options. More than 12,000 fewer Minnesotans enrolled this year, an 8% drop, despite record traffic and call volume.
That tells us that people were concerned. They were looking for ways to stay covered. They wanted to stay covered, but some of them ended up making that really tough choice and going without.
And she says it's a choice we will all pay for.
When people don't have health insurance, that doesn't mean they're not going to get sick. That doesn't mean they're not going to get injured, and they're still going to seek care. And so when that happens, they may use emergency services more. That puts burden on health systems, hospital systems. We all end up paying for this in the long run when people don't have health insurance.
Libby says Minsure is only beginning to understand the impact of these rising rates. She says enrollment could fall even more as people struggle to pay the increased premiums, especially for those who lost all tax credits, some of whom are dealing with increases of closer to 50%. Lauren.
So it could be a while before we see all of the fallout from this with costs and with hospitals and what they're dealing with.
Absolutely.
All right, Ken, thank you.